let's talk about heart blocks. This topic can be kind of confusing, but it doesn't have to be. So, first of all, we have to understand that when we're talking about heart blocks, we're not talking about a physical blockage like a thrombus in a coronary artery that causes an MI, right? We're talking about heart blocks. It is something that is blocking the conduction of electricity through the AV node, all right? It's all about that PR interval, which I think is a misnomer. I think it should be called the PQ interval because it's literally the time measurement from where the P begins to leave the baseline to where the Q begins to leave the baseline. So that's your PR interval. Normally, it is no longer than 0.20 seconds. If it is longer, then this is abnormally slowed electricity. So something is causing conduction to be abnormally slowed through the AV node. And so this is the first type of block that we're going to talk about. So it's a first degree AV block. Note, a first degree AV block is not a rhythm by itself, okay? It's either going to be sinus rhythm with a first degree AV block, sinus Brady with a first degree AV block, sinus tach with a first degree AV block. A first degree is not a rhythm by itself, okay? All it is abnormally slowed conduction through the AV node, evidenced by a PR interval that is greater than 0.20 seconds, okay? Conduction is still happening. Every impulse is being conducted from the SA node down to the AV node, through the AV node, and then the bundle of His. It's just abnormally prolonged. So that's a first degree AV block. And then we're moving down now to talking about the second degree, and this is where confusion sets in, I feel like, is differentiating second degree type 1s from second degree type 2. So a second degree AV block type 1 is a rhythm by itself, okay? So what the cause is, there is an increased delay of AV nodal conduction until a P wave totally fails to conduct through the AV node. So what you're going to see is increasing length of the PR interval. So the PR interval is going to get longer, longer, longer until a P wave is dropped, okay? And so you kind of can see that in this strip up here. So look at this complex right here, and then the very next one, the PR interval's getting longer, and then in the next one, the PR interval's getting longer, and then boom, we're dropping a QRS complex. Okay, so you have progressive prolongation, again, of the PR interval with each beat until a P wave is not conducted through the AV node. And so you see that as loss of a QRS complex, okay? So PR is getting longer, getting longer, getting longer. Then we drop a QRS complex, all right? It's also called Winky block. And when I was taught about blocks, my instructor said that Winky block is winking at you, like it's giving you a warning. Winky block is warning you that something is about to happen. So the warning is that progressive prolongation of the PR interval before we drop that QRS complex, before the P wave is not conducted through the AV node, okay? So next, as we're moving down, we're getting worse and more critical, okay? So with a second degree AV block type 1, we're not going to be doing too much, okay? We're literally not going to be running down the hall for this one. Second degree type 2, we are. So with the second degree type 2, again, this is worse, but so there's temporary failure in conduction, in the conduction system below the bundle of His. So remember, again, our electrical impulse leaves the SA node, goes down to the AV node, and then through the AV node is conducted through the bundle of His, and then we're depolarizing the intraventricular septum. So with a second degree AV block type 2, we have a temporary failure in conduction below the bundle of His. Okay, so what you're going to see is just intermittent non-conducted P waves without PR prolongation. So there is no warning that PR interval is not going to get longer. You're just going to, boom, drop a QRS complex because we're not conducting below the bundle of His intermittently. Okay, so with a second degree AV block type 2, again, it's not winking at you. It's not warning you by the PR interval getting longer and longer and longer. You're just, boom, dropping a QRS complex here. PR interval is the same. PR interval is the same. Boom, we drop a QRS complex. So with a second degree type 2, we're getting more concern. We're going to be getting out that atropine. We're going to be worried about the patient's blood pressure. We're even going to maybe prepare to transcutaneously pace the patient if the atropine does not work. So second degree type 2, we're getting concerned. We're getting very concerned with a third degree down here at the bottom. So a third degree AV block is complete AV dissociation. So no impulse that is being fired off above the ventricles is reaching the ventricles. So there is total divorce between the atria and the ventricles. So what you're going to see is absolutely no association between the P wave and the QRS. So you can test out if this is a third degree AV block or a third degree block by marching out your P waves. So literally your P waves are going to march out regularly. Your QRSs are going to march out regularly, but your P waves don't have anything to do with your QRS complexes, okay? They are totally doing their own thing. The atria are doing their own thing and the ventricles are doing their own thing. There is no communication between the two. All right, it's also called complete heart block for this reason. So I compare it to a divorce. So with a second degree AV block type 1, it's like the couple is fighting a lot. They're in counseling. They're kind of giving each other the silent treatment. Then with a second degree type 2, maybe the wife just kind of packs up and goes to stay at a hotel for the night or something without warning her husband. And then with the third degree AV block, they're divorced. There's no communication between the two. They're not on the same page. The wife, the P wave, and the husband, the QRS complex, are doing their own thing with no relation to each other whatsoever. So we are very concerned about the patient's hemodynamic status at this point. Atropine will not work on a patient in a third degree because the atria are not communicating with the ventricles. So we have to prepare to transcutaneously pace this patient. All right. So I hope this little breakdown has helped you guys, and happy studying. And as always, go Vols.